Hi everyone, my name is Dr. Jacobs. This week we're going to be talking about therapy models. Oftentimes, when you think about working in mental health, there are specific therapy models that are referenced. Cognitive behavioral therapy for psychosis, for example, is one of them. While that is a really effective model, if you've taken the serious mental illness class, that model is covered in that course. So we will be talking about other therapy or mental health practice models in this course, and one of them is compassion-focused therapy, otherwise called CFT. If you are unfamiliar with this model, great. And if you are familiar with it, just consider this a refresher. So again, I will be referring to compassion-focused therapy in this lecture as CFT. CFT is a relatively new modality. It was developed by British psychologist Paul Gilbert in the first decade of the 21st century. Some small studies and research reviews suggest it can be effective for the treatment of mood disorders, anxiety, serious mental illness, in particular psychosis. It also can help people who are especially prone to self-criticism manage that behavior in particular. Some researchers have also begun to test whether it can be beneficial for individuals that experience eating disorders and psychosis that occurs outside of serious mental illness. And there have been a lot of positive results so far. However, some studies that have been done on CFT have been small and there are not a lot of controls within them. So it is important to note that further research with larger samples is likely needed to determine the long-term efficacy of CFT on a larger scale, as well as identify what conditions this model can additionally treat. So yes, the slide picture is staying the same. CFT can be used, as I mentioned, to help manage long-term emotional problems related to persistent shame, self-criticism, as well as an inability to view oneself and one's behaviors kindly and compassionately. Potential clinical issues that can be helped by CFT include anxiety disorders, mood disorders, personality disorders, individuals that experience eating disorders, hoarding disorders, psychosis, different types of serious mental illness, as well as anger issues, individuals that struggle with body image, and individuals that are experiencing difficult dynamics within relationships. It has been used to treat children, teens, and adults, and it can be practiced in individual and group sessions. CFT treatment works towards the overarching goal of cultivating compassion for the self and others. To that end, the therapist will often start by teaching the client about the evolution of the brain, the construction of the self, and the systems that regulate emotions. So, Gilbert, the founder, theorizes that disruptions in the brain's emotional regulation systems lead someone to hyperfocus on a threat while disregarding the need to self-soothe. So, the therapist will then help the client develop key skills of compassion, self-compassion, and mindfulness via a technique known as compassionate mind training, or CMT. CMT is comprised of guided exercises that include role playing, visualization, meditation, and activities that are intended to foster an appreciation for daily life that aim to help the client recognize what compassion feels like and to help them become better at practicing it, both toward themselves and toward others. The goal is then for clients to realize and learn how to recognize self-criticism and develop techniques for diffusing it when it arises. This can include visualizing their internal critic or identifying compassionate images to call to mind during moments of self-criticism. Clients typically receive homework to practice these skills on days without sessions. CFT does require a high degree of self-focus, which can be incredibly challenging for individuals who are hypercritical of themselves or who dislike attention, and it may take several sessions before a client notices any positive effects or changes. So, CFT postulates that humans have at least three different emotional regulation systems. a threat and self-protection system, which generates anger, disgust, or fear to protect, a drive and excitement system, which motivates to seek outside resources like mates, food, and status, and a soothing and social safety system, which is activated when we feel peaceful and content enough that we are no longer compelled to seek outside resources. Imbalances between these three systems can result in maladaptive thought processes and behaviors, which is what is theorized by this model. People high in shame and self-criticism may not have had enough stimulation of their soothing system early in life and too much stimulation of their threat system. As a result, they can struggle to be kind to themselves or feel kindness from others. They may be highly sensitive to criticism or rejection, whether it's real or perceived, and internalize that disapproval. The goal of CFT then is to correct this imbalance in the emotional regulation systems. When Gilbert was developing this model, he drew on evolutionary, social, and developmental psychology, as well as neuroscience and Buddhist ideas, to specifically address clients' feelings of shame and habits of self-criticism, both of which often arise from abuse, neglect, and bullying. People who experience early trauma can come to feel that their internal and external worlds are almost always on the brink of hostility, Gilbert posits. Um, Gilbert also says that some people who have experienced early trauma, internal self-liberating and fear of outside rejection can lead to depression and anxiety. CFT overlaps with therapies developed to treat trauma, most of which address early memories, recognize negative thoughts, and correct misperceptions. But for some clients who struggle with shame and self-criticism, being able to counter unreasonable thoughts isn't enough. Without self-compassion, logic does not translate into feeling better, Gilbert notes. The goal of CFT is to replace feelings of hostility and insecurity towards oneself with compassion and understanding so that clients can begin to soothe themselves, accept soothing from others, and generate feelings of contentment and safety. So I did mention this briefly in the prior two slides, and you'll learn more about this as you work through the material in the module. But some of the techniques that are a part of CFT are soothing rhythm breathing. You can find videos for this on YouTube, but specifically be sure to search for CFT, soothing rhythm breathing, simple body scans and relaxation. And then it's creating a safe place. Then the next one is compassionate colors. Then it's the compassionate self. Then it is compassionate flowing out, and then it is focusing the compassionate self on others, and then compassionate flowing into oneself using memory, and then more go on from there. So in addition to CFT, this model will also, or this module, my apologies, also talks about social skills training. And this is very different from CFT because this is a behavioral-based, evidence-based practice for individuals with serious mental illness. It was developed for those with schizophrenia, but it can be used with others. So this aims to improve social functioning, community adjustment, and overall quality of life by teaching interpersonal skills. As I mentioned, it uses behavioral techniques, most often within a structured group format. It incorporates modeling, role-playing, and feedback. Most of the time, this model is ideally led by two co-therapists. Skills are broken down into discrete steps. After reviewing the steps of the skill, the therapist models the skill by demonstrating a role play, and then participants do the role play to learn and practice the skill. Therapists and group members provide constructive feedback to the individual after each role play, and each participant is given an opportunity to practice the skills several times. Repeated practice and overlearning of the skills are an important aspect of this model. Duration, frequency, and the exact content of the social skill intervention depends on the needs of the client and the treatment setting. It's also important to note that this model can be even more helpful when supplemented with community-based practice opportunities and supports. So those are the two models I wanted to discuss with you today. I really appreciate you being with me, and I look forward to our next conversation. Thanks. Bye.